I'm going to have a quick summary of what I think we learned today, but I learned today at least, and then I'm going to hand over to Joanna to tell you about some of the next steps that we have in mind. And you feel free to challenge us, after the meeting and share, sort of your perspectives after. So I'm just going to go through a very quick summary. I think we all appreciate and understand that you can only improve the quality of care if we invest in decentralizing primary healthcare. I think we've covered topics around managing supply, managing demand, managing outreach. We've definitely covered the importance of countries and states to invest and keep investing, especially after catalytic financing has really kind of created a pilot. That has been one of the biggest issues that we've also seen in our data, where private sector will get engaged in a particular program and it'll stop after a number of years because there's no one to take over, there's no sustainability inbuilt into the actual system. I think the role of private sector is extremely critical. Thank you for those that brought that up. And private sector is looking to partner up in some of these solutions, but they may not necessarily know how or why or understand how to make the best impact out of this. And of course, they all understand also that you need a sort of a long-term vision on these issues. Switching to different pages. I think we've definitely talked quite a bit on the role of decentralizing healthcare and universal health coverage, how you definitely need to pursue different financing models that are in favor of UHC. We have spoken about how to make sure that insurances also cover the different populations that need care, so that it's not necessarily benefiting only one or two segments of populations. I think have also spoken quite actively about how community health workers, female entrepreneurs who are developing solutions have a very strong dedication to this and are interested and willing to really work at the last mile on the last mile challenge. And so going back into Joanne's points that health workers need to be paid fairly, have benefits that are fairly, and that needs to be inbuilt into the investment case and the investment into these models that are working. And Geeta brought in several perspectives that we've recorded on how performance as an entrepreneur, performance in these initiatives needs to be seen in a different way and in a more sustainable way by investors and donors that are at the table, so that we can actually do good too and have a greater impact. So I think I try to summarize it in a nutshell because I knew I was low on time, but I do believe we have a number of good initiatives. Some have been scaled up, some have struggled to get further. A lot is in the maternal health and primary healthcare space, which is important. We couldn't find a central place where a lot of this was even captured. So we tried to kind of put things together. Thank you, Joanne and Joanne's team for putting that together from everywhere. And thank you for all those people who managed to put some text together to share it with us. Many of us are not connected. So I do believe that this is an opportunity to connect and get to know more about each other. We're happy to connect you to other organizations, agencies, whether you're seeking ideas, financing, or partners. I do think that this is the start of a longer conversation and a longer discussion on what are the next opportunities and how do we get there.